before ECS, even doing these studies, as I was, preparing during the residency and to be able to sit for the test. I mean, in the beginning, it was like the cognitive load to get through just a basic carpal tunnel study, for instance, was overwhelming. You get done with 2 to 3 studies and then you get home that night and you're just like wiped out and exhausted. But as I've progressed and grown, and especially post ECS, my confidence and ability to recognize patterns is much stronger and better. I'm much more efficient, can get through a test much quicker, feel much more confident in just the technical aspect of performing the test too. Like if I don't get a response on a sural sensory, I know that I'm not getting a response on a sensory and I'm not questioning if I'm just in the right spot. I feel much more confident in my tests, my reports, being able to send them to providers and be able to get the patient the correct treatment that they need.
And how you as a clinician and your approach to patients and to treatment plans has been before HODS and after HODS, before you started your training and now that you have pretty much getting to the level where you're at right now.
Yeah, I mean, so I think just having the ability to utilize diagnostics, I feel much more confident in my ability to diagnose them and give them the right treatment plan. But also, like, I just think my pattern recognition before I even do a test or a study has gotten so much better. I think before I went through the training, I had a huge bias to the spine being the contributing factor to almost everything. I didn't really give a lot of thought to peripheral nerve involvement much at all. And I know I missed things quite a bit, going before I went to the residency. So now I think just my ability to recognize patterns with patients, whether it's subjective complaints, but also just how I'm seeing the physical exam aspect work out, but then also being able to utilize the results to influence treatment and whether or not they're still appropriate for therapy or whether I should refer them out to a referring provider. Just the ability to utilize that has really just strengthened my practice and my ability to be a diagnostician, and also just help me develop relationships with other providers too.
I feel like there's not really a comparison to pre-ECS Luke and post-ECS Luke. I thought I, was a well-established clinician, having gone through an orthopedic residency, which due to COVID, I actually went through essentially twice. And I came out, you think at that time, I guess it's the Dunning-Kruger effect. Like you think you know it all, and then you drop down, you realize you don't actually know anything once I start this process again. And then like coming back up, it's starting to realize like, oh man, like there was a lot I didn't know, but a lot that I also didn't consider, like Ryan talked about with peripheral nerve entrapments. And then just my ability to hear a subjective complaint and be like, oh, did you think about this? Like even with my other clinicians, like, I've got a large staff at my clinic. There's 6 on the physical therapy staff and 2 on the occupational therapy staff. And they'll come to me with a question. And now a lot of times I can answer it significantly faster. Like, oh, did you check this? Did you think about this? Things that I may not have even considered before.